Hi, my name is Sydney Smith, and I am a registered nurse. I will be presenting the nursing responsibilities for point of care blood glucose testing for this interprofessional activity between the clinical laboratory and nursing. Upon completion of this activity, you will be able to describe the nurse's responsibilities during point of care glucose testing, recognize factors that affect the result accuracy, apply patient safety and quality principles, and collaborate effectively with the clinical laboratory. Before performing point of care glucose testing, the nurse must verify that an authorized provider's order is present. No laboratory test can be performed without a physician's order, or that testing is appropriate according to the institutional protocols. The nurse must then positively identify the patient using at least two approved identifiers, such as the patient's full name and date of birth, which are most common, or, in addition to the patient's full name, a medical records number. Proper patient identification is fundamental patient safety practice that helps prevent specimen and treatment errors. The nurse should explain the purpose of the glucose test, describe what the patient can expect during the fingerstick procedure, and answer any questions. Now, if the patient is a diagnosed diabetic, they probably know all about the process and the procedure, but according to protocol, you should do this each and every time. Clear communication helps reduce anxiety. It promotes patient cooperation and demonstrates respect for the patient's right to participate in their health care. And how you know that a patient understands completely what's going on is when they submit their hand for you to evaluate for the fingerstick procedure. Proper hand hygiene must be performed before and after every patient encounter. Gloves should be worn during specimen collection, and standard precautions must be followed to reduce the risk of exposure to bloodborne pathogens and prevent transmission of infectious organisms between patients and healthcare workers. Before testing begins, the nurse should gather all necessary supplies, including the gloves, lancet, alcohol pad if that's required, gauze, glucose test strips, and the glucose meter. So having everything assembled prevents you from scrambling around at the last minute when you realize you've forgotten something. The meter should be inspected to ensure it is functioning properly, approved for patient testing, and has successfully completed any required quality checks, including quality control. The nurse should evaluate the patient for conditions that may affect the accuracy of capillary glucose testing. The following conditions may cause either very high or very low inaccurate results in certain patient populations. Poor peripheral circulation, dehydration, edema, the fingers are very swollen and full of tissue fluids, shock, hypotension. When these conditions are present, an alternative specimen or laboratory testing may be necessary. Ensure that the finger is free of glucose contamination. If the patient's just eaten a candy bar with their bare fingers, I guarantee their glucose will go through the roof. An appropriate puncture site, usually the lateral side of a fingertip, should be selected to minimize discomfort and obtain an adequate blood sample. If cleansing is required, the site should be cleaned according to institutional policy and allowed to dry completely before puncture to prevent specimen dilution and inaccurate results. The nurse should perform the fingerstick using proper technique to obtain an adequate drop of blood without squeezing or milking. And if you've ever seen a cow milked, they squeeze down and it's very difficult for more milk to follow through until they release. This can result in a sample which is diluted with tissue fluids and cause inaccurate results. Correct specimen collection is essential for obtaining reliable glucose measurements. When performing the test, it must be performed according to manufacturer's instructions and institutional policies. The blood specimen should be applied to the test strip exactly as directed by the manufacturer's instructions and institutional procedures. Following the standardized procedures helps ensure accurate and reproducible results while maintaining compliance with regulatory requirements. And what they mean by reproducible is we could perform a blood glucose test in each of the 10 fingers, which you would never do because some of those are improper sites, and you would get within plus or minus acceptable range the same results. Prior to beginning the testing on the patient, the nurse should confirm that all required quality control procedures have been successfully completed and documented according to institutional policy. Patient testing cannot be performed if QC requirements have not been met or if the instrument is out of compliance. Quality control lets you know that your piece of equipment is working properly and that you can trust the results that are obtained. The nurse should review the instrument handbook carefully and understand common glucose meter error messages and recognize when a test result may not be valid. Appropriate actions may include repeating the test, replacing the test strip with a new one, troubleshooting the instrument in accordance with the manufacturer's instructions, notifying laboratory personnel who are overseeing the POCT glucose meter testing, or obtaining a laboratory glucose measurement if necessary. Test results should be documented promptly and accurately in the patient's electronic medical record or other approved documentation system. You cannot rely on your memory. You can't walk to the nurse's station and input the results from a piece of paper. You need to hold the meter in your hand, put the results into the medical record, and then verify, because I have at times had a clerical error where I added maybe an extra one or deleted a number accidentally. So put the result in, verify the result prior to releasing. Documentation should include the glucose value, the date and time of testing, and any additional information required by institutional policy. The interpretation of results should be done within the context of the patient's clinical condition. So the nurse should evaluate the glucose result and the patient's symptoms, their diagnosis, medications, nutritional status, meaning when's the last time they ate, because this absolutely affects glucose levels, and overall clinical condition. A glucose value should never be interpreted in isolation, meaning just because the results are 500 does not mean that perhaps that's an accurate result. You need to look at the patient's signs and symptoms that will correlate with the result that is obtained. And this should prompt unexpected results should prompt further assessment before treatment decisions are made. When glucose results fall within the institutional's critical value range, the nurse is responsible for notifying the appropriate healthcare provider immediately using established communication procedures. You've been provided with a document called SBAR, SBAR, which gives examples of how to communicate critical values to a healthcare provider. Timely reporting facilitates prompt intervention and helps prevent serious patient complications. And some of these can be life-threatening to a diabetic if they are not dealt with immediately. It's crucial to document the communication, which will include the name of the person you called, the time, and the date. For high glucose levels, the treatment option is usually to administer insulin or other types of interventions. Before administering insulin or initiating other glucose-related treatments, the nurse should verify that the test result is accurate and consistent with the patient's clinical presentation. If the result is unexpected or questionable, repeat testing or get laboratory confirmation whenever appropriate before treatment is initiated. You will follow infection prevention procedures, including safe disposal of sharps and contaminated materials. So as soon as the specimen is collected and you've documented your results, all used lancets, test strips, gloves, and contaminated materials should be disposed of according to institutional infection prevention and biohazard waste policies. Proper sharps disposal reduces the risk of needle stick injuries and occupational exposure to blood-borne pathogens. The final step in the process is to clean and disinfect the meter. Following patient testing, the glucose meter should be cleaned and disinfected using approved disinfectants and procedures recommended by the manufacturer. Proper disinfection prevents cross-contamination between patients and helps maintain compliance with infection prevention standards. In summary, the key takeaways from this presentation are patient identification and specimen quality are essential for accurate results. You must follow quality control, infection control, manufacturer's instructions, and institutional policies without fail. Interpret the results in clinical context based on the patient's presenting signs and symptoms, and collaborate with the clinical laboratory team to ensure accurate point of care testing results.